On to this now. Discovery Health has seen a stark decline in the number of members and beneficiaries on its priciest plans. The company says those who exited these plans last year exceeded the number of new members joining. A recent media report suggested that this could largely be explained by the immigration of wealthy South Africans. But as Discovery says, this is not the case. They are urging that while immigration did impact membership of some of its plans, it's not the primary reason for that decline. Joining us to explain what that reason is and what are some of the plans to make sure that clients remain with this particular scheme, even in the tough times, we've got the Chief Product Officer at Discovery Health, Deon Kotze. Thank you very much for joining us this afternoon, Deon. So Discovery Health saying it's not immigration that's causing people to move off the more pricier plans that the scheme offers, but there are some other reasons. Could you perhaps just break those down for us?
Yes, correct. And good afternoon to the listeners and the viewers. The main reasons for people leaving the scheme in any year is mostly due to people changing employment. As you know, different employers offer a different basket of medical schemes to their employees. And typically when employees move between employers, that would prompt a review of their chosen medical plan. So that would be the most common reason for people withdrawing from the scheme. Immigration is cited as a reason in some cases, and I have to kind of say that it's not limited to the top end plans or the more expensive options on the medical scheme. Immigration is cited as a reason across the medical scheme plan range, and it's important that people bear in mind that although affordability to some extent is determined by one's income, people often buy up beyond their affordability because of the need for specific benefits that are prompted by their healthcare needs. So it would be an incorrect assumption to make to say that people leaving top-end plans or more expensive plans are the wealthy. That may be because of a change in healthcare needs or because of a change in circumstances.
So that change in circumstances and need is one component here, but you did mention affordability, and you'll find that people don't necessarily leave the scheme in total based on their new employment or whatever, but affordability may force them to perhaps downgrade to more affordable options within Discovery Health. Have you found that to be the trend since the advent of COVID-19 and really just the higher cost of living?
Actually, quite the opposite. Prior to COVID-19, when people have been presented with the opportunity to change their plans, which are typically around the 1st of January each year for existing members, because that's the opportunity that you have to upgrade or downgrade, and typically financial advisors will consult with their clients during that period. Prior to COVID-19, we saw approximately 6% of the members of Discovery Health Medical Scheme taking the opportunity to make a change in their plan choice. So 94% would remain on exactly the same plan and make no change. Of the 6% that changes, it's roughly a half split between those that decide to upgrade their option and those that decide to downgrade their option. Typically, the reason for a downgrade is, as you mentioned, affordability, whereas the upgrade is typically because of an increased need for healthcare services. Then, since COVID-19, though, that trend has changed, and now when people are presented with that opportunity at the point of a contribution increase, we saw only 3% of people taking the opportunity to make a change in their plan. So 97% of the scheme remain on exactly the same plan. We believe it's because COVID-19 has shown people the importance of the cover that they have for healthcare, and therefore people are reluctant to make a change. And we see more upgrades than downgrades. About 1.7% of the membership would upgrade their plans, 1.3% would downgrade their plans given that opportunity. If it was a case where we saw members leaving and it has a significant impact on the membership of the scheme, that would be a concern. If it was a case of people leaving and it changes the normal plans that we would expect people to be on, that would be a concern. But since COVID, we've actually seen the opposite. Plan movements have reduced. The plan choices have remained quite stable. And in fact, we've seen a significant growth in the medical scheme since the advent of COVID-19.
And unfortunately, I suppose one of the big things there, as you allude to, Deon, is the disease burden that has come as a result of COVID-19 and the long COVID and other effects thereof. I just want to ask, with the changing world and the changing needs of your clients and consumers in general, has Discovery Health looked at creating or curating different options for clients who are looking for certain benefits for their health needs, but not necessarily what one particular package would offer? Are there any innovative ways that you are engaging clients and potential clients and consumers on what Discovery has on the table, on offer, as a curated need for them?
I think maybe the most important thing here is for many employers, they want to extend healthcare to as many employees as they possibly can. And this has been a problem for a long period of time, either because of the employee's inability to afford membership of the medical scheme, or the affordability for the employer of subsidizing the employee on a medical scheme. And for a long period of time, the industry has been lobbying for what we call low-cost benefit options. Low-cost benefit options would effectively operate on the basis that there would be an exemption for those options in terms of the prescribed minimum benefits that they have to cover. All medical scheme options, regardless of the price, have to offer a package of prescribed minimum benefits. And in the case of low-cost benefit options, the ask is that some of those prescribed minimum benefits be exempted. That would allow medical schemes to offer a much lower cost benefit option and would offer people a more affordable option to belong to medical schemes. That process is ongoing, and there's constant engagement between the industry and the Council for Medical Schemes, which is the regulator of medical schemes, and their governing body, which is the Department of Health, in terms of the introduction of low-cost benefit options. Then, in the absence of those low-cost benefit options, though, there are health insurance products outside of medical schemes which do offer a minimum package of benefits to employees that cover the basic needs of people, for example, primary health care only. And that is really in response to a need for health insurance that is below the cost of medical schemes then.
Thank you very much for your time and that update, Deon Kotze there, who's the Chief Product Officer at Discovery Health, giving us a sense of the trends that are happening in the medical aid scheme space and what consumers are vying for in the current times. Still to come.